What if I told you that millions of Americans could lose Medicaid coverage not because they are ineligible, but because of the 80 hours work rule? Signed into law in 2025, these rules kick in by 2027. The One Big Beautiful Bill Act just rewrote the rules of who qualifies for Medicaid, with some of the biggest changes set to begin soon. In this video, I'll break down exactly what's changing, who's affected, and what all you need to know to stay covered. Hi, I'm Manmeet Chadha, and here on Health Tech Decoded, I clarify all your queries related to healthcare and associated technology. Here, let's understand the Medicaid cuts introduced as part of OBBBA. It stands for One Big Beautiful Bill Act, a major law passed in 2025 that changes how Medicaid works in the US. As part of the OBBBA Medicaid impact, I'll be covering the Medicaid eligibility changes, work requirements of 80 hours, and changes to retroactive coverage, the changed copay requirements, the Medicaid impact on rural hospitals, the more frequent eligibility checks now required, and the changes to the Planned Parenthood funding. Let's understand the Medicaid eligibility changes introduced as part of the One Big Beautiful Bill Act. Some work requirements have been introduced to be eligible. Individuals aged 19 to 64 must work at least 80 hours per month. That can include employment, volunteering activities, training, or attending school. Some people are exempt, example those with young children aged 14 and under, people with disabilities or medical conditions. The retroactive Medicaid coverage change now. When someone is approved for Medicaid, their coverage can be backdated up to 30 days before the date they applied, as long as they were eligible during that time. Prior to OBBBA, some states allowed up to 90 days of retroactive coverage. Now it's capped at 30 days under federal Medicaid rules. Let's take an example. You apply for Medicaid on August 1st. The bills back up to July 2nd will be covered by Medicaid, even though you hadn't applied at that time. The retroactive coverage prevents individuals from being hit with big medical bills. In spite of the work requirements for Medicaid eligibility, the good news is that the bill provides so much flexibility around the work options. The enrollees have ample ways to meet the requirements in case they have any kind of limitations to employment. Officially, this criteria will be enforced starting January 1st, 2027. So before December 2026, the able-bodied adults should be engaged in a qualifying activity to keep availing the Medicaid benefits. But because each state administers differently, do keep a close check on your state rule-out timelines. Not only this, even a copay of up to $35 is introduced for enrollees with family incomes between 100 and 138% of the federal poverty level. Let's also understand the impact on rural hospitals which heavily rely on Medicaid payments. The new law cuts down how much states can tax the providers. Now, the law mandates that the final cap for taxing the providers should be 3.5% by the year 2031. 6% going down to 3.5% by 2031. Because it's hard for states to raise money to fund Medicaids, the rural hospitals may get hit by this change as the state may likely lower the Medicaid reimbursement payments to such healthcare institutions. But please note that this reduction is phased in over several years. OBBBA gives states time to adjust their medical financing strategies. Also, the One Big Beautiful Bill Act does create a $50 billion rural hospital fund, doubling the previous fund that it had for the rural hospitals. It's a dedicated pool of money to help rural hospitals and clinics that are struggling financially, especially due to Medicaid cuts. Hospitals may apply for this aid, but at the same time, this fund will not fully offset the cuts brought in by the OBBBA. It's meant as a safety net for those hit hardest by the changes in the bill. Yes, the government added a big safety net to help the rural hospitals, and that's a good thing. But that doesn't mean that all providers will be fully protected. Some may fall through the cracks due to funding limits, bureaucratic processes, provider eligibility, or other delays. Now let's understand the changes to the frequency of checks. States must now recheck the eligibility every 6 months instead of once a year. If you change jobs, your income goes up, or you forget to submit paperwork, you could lose Medicaid coverage sooner than before. This more frequent check begins in 2027 to make sure the individuals still meet the income and the work hour rules for Medicaid. This means more paperwork, more deadlines, and a higher risk of losing your healthcare if you miss something. Let's now see what changes are proposed for organizations like Planned Parenthood. Planned Parenthood is an organization for community health clinic for reproductive and sexual health, especially for people with low income or no insurance. They help with family planning, birth control, STD checks, cancer screening, and education. The One Big Beautiful Bill Act prohibits Medicaid to fund Planned Parenthood or similar organizations for 1 year. On July 7, 2025, the administration was sued over this provision by Planned Parenthood. On July 8, 2025, a judge for now has put the rule on hold. With this change, clinics like Planned Parenthood would not get paid by Medicaid for the services they provide, like birth control, cancer screenings, STD tests, etc. This block by OBBBA can be renewed after 1 year or even challenged in court, which it already is. For now, these clinics can still get paid through Medicaid until a final decision is made. With all this information, I hope you get clarity on the Medicaid changes introduced as part of OBBBA. Do subscribe to the channel for more such content and watch this video in case you need to know more about the Medicare versus Medicaid enrollment rules.